Hi, I'm Laurence Clark from Pathways. I hope the conference is going well. And now I would like to talk about disabilism, NHS services, and COVID-19. So, as I'm sure you've already covered this morning, disabilism means thinking or acting as though disabled people are worth less than other people. And I think we've known for a long time now that when it comes to health services, people with learning disabilities and people with autism are not getting fair access. There's been various reports, most notably the leather work, which looks at the causes of death of people with learning disabilities, which showed this to be the case. But last month, two reports were published that show that COVID-19 has shown this even more. So COVID-19 or coronavirus has really shone a light and proved how people aren't being treated equally. So the first of these reports was from Public Health England, and it looks at the numbers of people who died from COVID-19 with learning disabilities in the spring of this year. It did this by looking at the information from the letter review, but also information from hospitals, from care homes, and from social care services. So the first time someone with a learning disability died with COVID-19 this year, we think, was in February or March. And by June the 5th, probably almost 1,000 people with learning disabilities had died. That's a staggering amount. Seemingly all of this year, every time we switch on the news, we hear these horrific big amounts. And it's quite hard to imagine, to kind of visualize them. So on the slide here, you can see the number of gravestones. The number of gravestones from those deaths, as you can see, are almost too small to be seen. So how many people died each week? Well, this slide has a couple of graphs. Don't worry too much about reading them. The important thing to notice is this. Both graphs show how many people on average would die in that week every year. And then in the darker colour, how many people died this year. So the blue one is for people with learning disabilities, and the red one is for the general population, so everyone. And the thing to notice here is that the gap between the dark blue and the light blue is a lot bigger than the gap between the dark red and the light red. And this means that the difference was bigger for people with learning disabilities. So COVID-19 is affecting this population to a great level. Who was most at risk? So the report found that some people with learning disabilities were more likely to die with COVID-19 than others. Like the general population, older people were more likely to be at risk. But it also found that men were more likely to die than women, and that Asian and Black people with learning disabilities were more likely to die than white people. People with learning disabilities living in care homes were more likely than others to die. I guess this is because if you live in a care home, you're around more people, so there's more chance for infection. However, it wasn't as bad in care homes for people with learning disabilities as in other care homes. And this is probably because they have fewer people living in them, so the infection can't spread as easily. So the second report that was published was from Leather. And this looked specifically at the deaths of 163 adults. It found a big difference between the people with learning disabilities and people in the general population and how old they were when they died with coronavirus. So with the general population, nearly half of the people who died were over the age of 85. However, in people with learning disabilities, half of the deaths were in people aged 50 to 69. So people are dying younger. Nearly 1 in 5 of the people they looked at have been shielding. And most of the people who died who've been shielding have been living somewhere with paid staff. So a nursing home or a residential care home or supported living. And they were thought to have caught the infection from other people living in the home or from the staff. It found that some people have problems getting good health care. For example, yes, she turned my phone off. She's like, there we are. So, for example, they found it difficult getting hold of NHS 111. They had difficulty getting hold of a test for COVID. I can't wait. 1 minute.
Hello, we are not available now. Please leave your name and phone number after
So, yes, they couldn't get a test for COVID, and they couldn't get to see a specialist learning disability nurse. About 1 in 5 of the people who died had not had reasonable adjustments made for them. And the kind of reasonable adjustments were things like having specialist learning disability services in the hospital, making sure that the person's care was right for them, and making sure the person was supported by someone they knew, especially when they were in the hospital. So just over half of the people that were sort of received good care, which is under half and not. And the people writing the report found there was instances where a person's age or their learning disability was given as a reason to put a do not attempt resuscitation, a DNA CPR on them. So DNA CPR is a decision that's made when the doctors think it wouldn't be a good idea to try and restart a person's heart if it stops beating. And it's a sign of disabilism. It's a sign of people not valuing the lives of people with learning disabilities and other disabled people, not valuing our lives in the same way that they would others. Coronavirus has also brought some other problems for people. People couldn't always meet face to face. People weren't able to go to the hospital when they should have been able to. There weren't enough experienced paid staff to support people in their homes. And some people didn't have a good death because their families couldn't visit them. So, it's all a bit gloomy, I know. But there has been some good sides the last 9 months or so, because what we've seen is people coming together online, people finding ways to meet, to talk, and to come up with solutions. And that's what today's about. That's what this conference is about. So the question has to be, going forward, how can we get rid of disablism in our health services? How can we address some of the problems that these two reports have highlighted? And because we're now coming together stronger than ever, now is the time to solve this, to get together and talk about it. I've been Laurence Clark. Thank you very much.